I think at all levels there should be some sort of screening. Obviously at the higher level, where you're well resourced with physios and strength and conditioners, performance coaches, that they're going to have your functional screening and their medical screening, their physiotherapy, musculoskeletal screening. It's very easy for parents in local clubs, in junior clubs, to see their local physios. Sometimes it's worth trying to find a physio who has a special interest in that sport, be it football, be it rugby, be it AFL or netball. They may have a more particular screening that pertains to that sport. But physios will run through a screening where they'll test their joints. If it's a contact sport, there are some special tests that they might do to clear their necks of any issues. They can test their ability to balance, to cut, as Sharon spoke about earlier, their strength and endurance in certain muscle groups. And this way, after screening, we can get a number of areas where there are deficiencies, strengthening exercises, improve that and send them off. If they're then doing their preparation to perform program as well, even better. Even better. So screening should be a part for all athletes before they take part in these team sports.
I think there's a couple of things about screening that are really important. One's the medical side, and so we can pick up from the medical side. We obviously can look at concussion, if there's any history of concussion. There's also a cardiac risk that they can be questioned on. It's a first point of contact with a child or a teenager to institute any form of education. And then there's the musculoskeletal screening side. So it's a perfect opportunity to have both education and then guide a player into the sport.
And prevent injuries. You might find someone has a more lax or unstable shoulder on one side, and you may recommend strapping or bracing, and that child may never see an injury because they're protected and because they've done a strengthening program on that limb.